For surgeons like Amit, knowing how to sew accurately can be the difference between life and death.
This is a skill which is so essential to surgical training and to surgical practice.
But it's not something surgeons are born with. So consultant surgeon Ayman Al-Zatani holds suturing workshops for Southampton's medical students.
The whole idea about any kind of surgery, you break it down into its components, placing the sutures, then tying them down.
And it starts with something simpler than an aortic valve.
Not too ripe, not too hard. You just need to make an incision. The banana is a very easy and available piece of fruit which has a skin and a flesh. You go at a right angle and you can push from the back and it comes from the other side.
Students Lorinda and Gadir use a synthetic thread, one of over 10 different types used in surgery.
When you pull it through, you'll see there's a natural way the suture is holding, yeah?
If they don't learn the 1,000-year-old technique correctly, they could cause fatal leaks and infections.
So suturing is bringing two edges together. If you leave them apart, healing may not happen. Right angle, yes, good, good. Don't hold the tip. There's a lot of mysticism about surgery, that it's something which only gifted people can do, and I would argue that surgery can be taught to anybody. That's nice.
Every stitch must be tied off, and this is where Ayman increases the challenge.
Good. She's basically doing her knot with her eyes closed. In surgery, some parts of the body are away from our vision, so when we are working inside a tummy or a chest, it's difficult to see where your hands are. Now it's nice and flat, see? That's better. We train our students to see with their hand.
The students also learn to stitch blood vessels together using rubber tubes.
You can pull both ends and bring the anastomosis down. Pull that through, land it in.
Okay.
Today's session is voluntary for students who have ambitions to become surgeons.
You need to know the relationship between your fingers to each other and to the things in front of you. And those skills are very basic and they can be developed. I see. Okay.
I'm mixed up my...
Instead of the 1 o'clock there, you've done it 5 o'clock,
yes.
Exactly.
It is very daunting. It's very scary to do it on a real-life patient, but I guess more practice makes better surgeons.
Make sure you don't run over your sutures.
It's so much harder than it looks because you have to get your needle in the right position and then change it, and everything is so small, and it's like it feels very hard to do it just with your hands.
For me, the legacy of surgeons is not how many patients you treat, it's how many surgeons you train to do the job. The more you train, your service to humanity extends beyond the ones you treat.